Ready.
Okay, I have Kathleen DeMarchi who's here with me today, and one of her issues, like a lot of patients that have had multiple surgeries in the past, she's an athletic person. What we thought was a good idea many, many years ago to take the meniscus out catches up with you later in life. So she does have some arthritis, and she may indeed be walking down the road to need a partial or a whole knee replacement. We have many tools in our armamentarium to sort of prolong the life of this knee and keep her out of the operating room. And of course, one of them, besides over-the-counter anti-inflammatory supplements, are injections. A couple different injections. One of the most historic and predictable is a Depomedrol or a cortisone injections. So a lot of patients are afraid of those, and if you use the proper technique, it can be very helpful and prolong the life of the knee. So Kathleen was kind enough to let me use her knee in demonstration. So I'm just going to go through some of the steps. You have to know the surface anatomy. You have to know where to inject the knee. If you don't need an aspiration, one of the easiest places is right next to the patellar tendon. It's called the lateral fat pad. We like to inject there after we use some ethyl chloride, which is a cold spray, because there's almost no superficial nerve fibers right there, and it's one of the easiest landmarks to know. So we do it with a very tiny 27 gauge needle. We put a touch of lidocaine, which is like a Novocaine, right in the skin, and right where my finger is. I just put a little Novocaine there, and unlike other parts of the body, it's very comfortable. A small gauge needle allows us to put a touch of Novocaine in, and that's all we do. So we don't have to stick twice if we change the barrel under sterile technique, and then we'll get our medication, which is close by, and we just make sure that it's of the appropriate dose. We just change it, and Kathleen is pretty comfortable, and I'll ask her, and you feel the resistance, and there's almost none going in. Do you feel pressure going in, Kathleen?
No, that's good.
So I always ask for pressure. If you feel pressure, it may be in the soft tissue. And again, we just take our time and we put in approximately 2 cc's. And this can take a couple days to take effect. We always tell the patient it can take 2 to 4 days. It usually doesn't hurt today. And just take that out. We hold a little pressure on that. We put a little Band-Aid. And then that's it. That's our technique. So I hope that's helpful.